Normal sodium levels 135 to 145 mg/kg. Normal potassium levels 3.5-5.5 mg/kg. Normal calcium levels 8.5 to 10.9 milligrams per liter. Normal chloride levels 95 to 105 mg/kg. Normal magnesium levels 1.5-2.5 mg/kg. Normal phosphorus levels 2.5 to 4.5 milligrams per deciliter. Normal RBC count 4.5-5.0 million. Normal WBC count 5,000 to 10,000. Normal platelet count 200,000 to 400,000. Normal hemoglobin 12 to 16 gms women, 14 to 18 gms male. Normal HCO3 24 to 26 mg/kg. Normal CO2 35 to 45 mg/kg. Normal PO2 80%-100%. Normal SO2 greater than 95%. Normal glucose levels 70 to 110 milligrams per deciliter. Normal specific gravity 1.010-1.030. Normal BUN 7 to 22 milligrams per deciliter. Normal serum creatinine 0.6 to 1.35 milligrams per deciliter. Normal LDH 100 to 190 UL. Normal CPK 21 to 232 UL. Normal uric acid 3.5 to 7.5 milligrams per deciliter. Normal triglycerides less than 150 milligrams per deciliter. Total cholesterol 130 to 200 milligrams per deciliter. Normal bilirubin less than 1.0 milligram per deciliter. Normal protein 6.2 to 8.1 grams per deciliter. Normal albumin 3.4 to 5.0 grams per deciliter. Therapeutic drug level of digoxin 0.5-2.0 ng/ml. Therapeutic drug level of lithium 0.8-1.5 mg/kg. Therapeutic drug level of Dilantin 10 to 20 mcg/dl. Therapeutic drug level of Therphylline 10 to 20 mcg/dl. Normal heart rate 80 to 100. Normal respiratory rate 12 to 20. Normal blood pressure 110-120/60-90. Normal temperature 98.6 degrees Fahrenheit. Normal FHR 120 to 160 bpm. Normal variability 6 to 10 bpm. Contractions should be normal frequency 2 to 5 minutes apart, normal duration less than 90 seconds, intensity less than 100 millimeters per hectogram. Amount of amniotic fluid 500 to 1200 milliliters. Results of nitrozine paper. Urine green, amniotic fluid blue. APGAR score A appearance P pulses G grimace A activity R reflexes done at 1 and 5 minutes with a score of 0 for absent, 1 for decreased and 2 for strongly positive. Why is FA-B9 important? Folic acid and B9 are important in decreasing the chance of neural tube defects. When should a client start taking B9? 3 months prior to becoming pregnant. What are early deceleration? Begin prior to the peak of the contraction and end by the end of the contraction. They are caused by head compression. There is no need for intervention if the variability is within normal range and the fetal heart rate is within normal range. What are variable deceleration? What are late deceleration? What is Torts syndrome in a neonate? This is a combination of diseases. These include toxoplasmosis, rubella, cytomegalovirus, herpes, and syphilis. Pregnant nurses should not be assigned to care for the client with toxoplasmosis or cytomegalovirus. What is STOP? This is a treatment for maternal hypotension after an epidural anesthesia. 1. Stop infusing potassium. 2. Turn the client to the left side. 3. Administer oxygen. 4. If hypovolemia is present, push for fluids. Monitoring for Coumadin. PT 10 to 12 seconds. Antidote of Coumadin. Vitamin K. Monitoring for Heparin. Lovenox. Dalteparin. PTT 30 to 45 seconds. Antidote for heparin. Protamine sulfate. Therapeutic levels of anticoagulant therapy. It is important to maintain a bleeding time that is slightly prolonged so that clotting will not occur. Therefore, the bleeding time with medication should be 1.5-2 times the control. Rule of nines, abdomen and chest. 18%. Rule of nines, head. 9%. Rule of nines, arms. 18%. Rule of nines, back. 18%. Rule of nines, chest and abdomen. 18%. Rule of nines, legs. 36%. Rule of nines, genitalia. 1%. What is the renal therapeutic diet? High calorie, high carbohydrate, low protein, low potassium, low sodium, and fluid restricted to intake equals output plus 500 milliliters. What is a gout diet? Low purine, omit poultry medication for acute episodes, colchicine, maintenance medication, xyloprim. What is a heart-healthy diet? Low fat. What is Rome? Respiratory acidosis. pH down, CO2 up and HCO3 up. Metabolic acidosis. pH down, CO2 down and HCO3 down. Respiratory alkalosis. pH up, CO2 down and HCO3 down. Metabolic alkalosis. pH up, CO2 up and HCO3 up. What is the difference between Addison's and Cushing's disease? They're diseases of the endocrine system involving either the overproduction or inadequate production of cortisol. What is the treatment for a client with Addison's disease? Increase sodium intake. Medications include cortisone preparations. What is the treatment for a client with Cushing's disease? Restrict sodium. Observe for signs of infections. What is the treatment for spider bites bleeding? Rice. What is the treatment for sickle cell crisis? HHOP. What are the 5 P's of compartment syndrome? Pain, pallor, pulselessness, paresthesia, pallor. Risk for hip fractures. Hemorrhage. Risk for femur fracture. Fat emboli. What is the profile for gallbladder disease? Fair, fat, 45 pregnancies, flatulent. Cultural consideration, Arab American. Cultural considerations, Asian Americans. They avoid direct eye contact. Feet are considered dirty. Males make most of the decisions. They usually refuse organ donations. They generally do not prefer cold drinks. Believe in hot-cold theory of illness.